I got gloves. All right, the ones in the room are thick and I can't feel with them. These are the good ones. All right, we're gonna go see a young man many of you have seen before. He's our guy with Krabbe. We have life missions. We don't always understand what they are. Like, I'm over 60 years old and I'm starting to understand some of mine. He already is fulfilling a life mission that we're becoming aware of.
Yeah.
And you're helping make that possible by informing everybody about newborn screening that's not expensive for something that's devastating, that's not easily, but fairly easily treated to prevent the progression.
Yes.
I mean, and Emmett's gonna save, along with all the others who are a part of this movement, save the life of maybe your child or your best friend's child who's gonna go ahead and get this screening done. But today we're looking at a very interesting eye issue. Hello.
Hi.
Hey.
How are you?
Emmett.
Good.
Hi, Emmett. You're just so calm today.
His hair.
He's got some major hair.
Oh my gosh.
It's mostly of Emmett, right?
Yes, it's mostly of Emmett.
All right. So, today's video is sponsored by Let's Get Checked. Wouldn't it be nice from the comfort of your home if you could just get a kit mailed to you and get some of the labs you've been wanting to get done? You do them yourself. Pop them in the mail. You get your results within a week. You will actually get them reviewed by a physician, and a nurse will call you and go over these results. And if appropriate, they will often give you actual recommendations based on your results, and right from the comfort of your home. I am now able to bring this to you. There's a promo code DrPaul20, DrPaul 20. You get a 20% discount for your purchase by using that code. So for women and men, get your essential vitamin panel. Includes vitamin D, folate, and B12. These are probably my 3 most important nutrients that I want you to be aware of your status and take supplements if you need to. These are the key nutrients for healthy brain function. These are the key nutrients you need to have optimal focus, to prevent depression and anxiety. So many things that so many of us struggle with. So I've got direct links to the test I'm recommending you consider, but feel free to browse all the options they have because you may have a specific interest. I'm using this very test myself, just ordering my kit now with you, and we'll go over our results when I get them back. There's an obvious issue going on with that upper eyelid.
Right.
Tell me, when did that start?
Well, he got a sty not last Sunday, but the Sunday prior. And it was very minimal. And then on Monday, it was a little more inflamed. And then it's just gotten progressively worse.
Yeah.
Yesterday was the worst. And I sent you that picture over text.
That's legit. I'm surprised I hadn't seen you sooner.
Right.
You're usually pretty quick to come see me. Okay. And it's clearly kind of started to drain there in the middle.
On the top, yeah.
That's actually fortunate because that's the real fast way to get one of these things to get better.
Oh yeah?
Is to have it drain. And the reason I was referring you to ophthalmology was because they might lance it, but they don't let us lowly pediatricians lance things near the eye.
Sure.
That's kind of a specialist thing.
Okay.
So I'm gonna see if I can get anything to... Sorry, buddy. I know that might be a little tender. Yeah.
Yeah, I know, right? He's gotten so big.
Hi, buddy. Alright. So probably... Have you tried warm soaks on it?
Oh, we've been doing warm soaks
Okay.
nonstop.
So the warm soaks, I got a little moisture on there, so I bet I got enough to grow a culture.
Okay.
I'm gonna send that off for culture. I don't want to hurt him. So we'll have that going.
Okay.
And then, is he on any antibiotics right now?
He's on a Cipro drops.
Just the eye drops.
Yeah.
That's appropriate.
Okay.
He also needs an oral
Okay.
antibiotic, which of course in his case you can just use his G-tube.
Sure.
Because we've got, when you get that much redness, so there's sorry, I'm just gonna push. It's gotten firm. Darn. Firmness can be abscess, like pus that's gotten so tense that if I was to lance it, it would go right, or it's just in the process of getting there. The redness across here is what we might call a cellulitis, and because it's around or near the eye, it's periorbital cellulitis.
Okay.
It's stable, right? It's not getting worse in the last 24 hours, because that looks about the same as the picture you sent me.
Yeah, it's about the same.
So that's reassuring that we're not in danger.
Okay.
If it was getting worse, you would see that whole eyelid swelling to the point where the eye is shut.
That's how it looked yesterday.
Okay,
was that
so
it was swollen shut.
So if anything, it's a little better.
Yeah.
Sometimes with periorbital cellulitis, he doesn't have a deep line, does he? Just the feeding tube. He doesn't have like an IV port or anything like that. Sometimes we'll do a medication called ceftriaxone.
Okay.
And it's a IV or a shot. But I think because it's better today than it was yesterday, we just go oral antibiotics and then continue really as much as you possibly can the heat to see if we can get it to drain more.
Sure.
Because actually it's the drainage that's going to cure it.
Right.
Yeah. Even more so than the antibiotics.
Okay.
Any other concerns today?
Do you think we still need to go see the ophthalmology?
Not if he's getting significantly better.
Okay.
Alicia, the night nurse, thought she saw thrush in his mouth, which I did give him good oral care, and I didn't see it. I didn't see anything that looked like it. But
Yeah, let me look. We look at the gums, and those look okay. And then the cheeks, we're looking for white plaques. I don't really see anything there that I would say is for sure thrush. No, I wouldn't jump on it. Let me do one more thing. Look at the back of the tongue. Sorry, buddy. Yeah, there's a little whiteness on the very back of the tongue, but that can just be coating. So, heat to hopefully get that to drain.
Okay.
And if it's draining, help it to drain, like
A little bit of pressure.
a little bit of pressure, not to make
Not
him
too much, but-
uncomfortable and not to put too much pressure on the eyeball, but
Yes.
like you could probably see where you could kind of squeeze like this, so you're not squeezing the eyeball, but you're trying to squeeze that
Okay.
pus out.
Oh, buddy.
If he can tolerate it and it's draining, because the more we get out, the faster he gets better.
Sure.
And then we'll do Augmentin if he tolerates it. I can't remember, does he have allergies?
Mm-mm. Not that we know
Okay.
of.
So we'll do Augmentin, the 600 ES version. That's the least rough on the stomach.
Okay.
So we'll start with that. If he was getting worse, I'd be doing the ceftriaxone shots, but I
Sure.
don't think he needs that right now.
Okay.
Thanks for watching, guys. Now, see in the link below, we've got links to this young man's other important videos about Krabbe's, which we all should know about because there's newborn testing that's now available, and if you figure this out early, you can actually avoid this. There's now a treatment, and that's what people didn't know. The reason it wasn't in most newborn screens, still isn't in many, is that the treatment's relatively new. So yes, if you're having a baby, check out these links below and get yourselves educated on this largely preventable, treatable condition.
You got something, Mom?
And Emmett, for those that want to follow his story, we
Yes.
have a YouTube channel now for Emmett called Emmett's Army.
Oh yay! So you
So-
guys
First
check
link
out.
in the description, yeah.
Yeah. Check out Emmett's Army. He's got an army now, and this young man is changing the world for the better. He's got a rough condition that he's having to deal with, but he's not letting it happen in vain. So become a part of Emmett's Army.